slide. So for those of you that don't know me, I'm Megan Blacker. I'm one of the career development consultants at Careers. I'll be hosting this event today. I'm really excited to be here and to see so many of you that have taken the time out of your busy schedules to be with us today. So thank you so much. Before I introduce our panelists to you, just to explain how we'll kind of move forward with the event, just please make sure that your mics are turned off as well as your cameras, because it can be a little bit distracting. And then also you can see that this session is being recorded for the benefit of those that are not here today. And you will have an opportunity to ask questions. So, whilst we move along, please pop it in the meeting chat. And we'll get to it, or get to as many as we can as we move forward. Yeah, and I think I've covered all of that. So if I can ask our panelists to please switch on their cameras so that I can introduce you. Fantastic. So I'm really excited that you are all here today. Thank you so much for taking the time out. I know your busy schedules to be with us today. Yeah, I would like to warmly welcome Ms. Samantha Malunga. She is a program officer at ELMA Philanthropies. And then a warm welcome to Dr. Motlatso Godongwana. She's an associate at Genesis Analytics. And last but not least, to Dr. Shrikant Peters, who is a medical manager of the perioperative and critical care services at Groote Schuur and a public health medicine specialist. So really lovely to have all of you here today. And I think let's jump in with our first question so that we don't waste too much time, because an hour flies by so quickly. So yeah, my first question is, tell us a little bit about your career journey, a brief account of your career journey. And so we'll start with you, Samantha, and then Motlatso, and then Shrikant afterwards, please. So over to you, Samantha.
Okay, thank you, Megan. Just very shortly, just to say, I started off in humanities. So anyone can get into public health, anyone can, with a passion, can shift careers into public health. So I started off doing gender studies and law for my undergrad, and then I did an honors in gender and transformation. And I had a focus on sexual and reproductive health rights and a passion for HIV/AIDS and social determinants of health. And I came across the social and behavioral sciences track for the Masters of Public Health at UCT. And I enrolled, and I was a SASH fellow, which allowed me to get exposure to work that's being done in public health, but from a qualitative perspective. And once I graduated, it was before I graduated, I did it over 3 years. So there's no one should ever tell you should do it in a year or two. I think take as long as you need. And what allowed me to figure out what I wanted to do in my career was that in my second year of my master's, I was looking for a research focus, and I took on an internship at Pediatric AIDS Treatment for Africa, which was an NGO working with adolescents who are HIV positive on the continent. And that just, I got into the NGO space, and I was like, well, these people are doing work on the ground, impacting people's lives at a grassroots level. How do they get the money that they're spending? And why do they keep applying to this like entity called ALMA? And that's when I was like, okay, well, who are they? And that's when I understood that there's donors. And I looked into it, and I applied, and I entered that space as an associate program officer, got to learn the skills of grant creation and grant management. And then this year I got promoted to program officer. Yeah. That's me.
Sure. Thanks. Thank you, Samantha, for sharing that with us. And I'm so glad you mentioned about the Masters of Public Health, because it pulls in a wide range of students from different backgrounds. And I think that's really interesting to know for students who were unaware of that. So thank you for sharing that, and definitely a career journey. So over to Motlatso, if you don't mind.
Thanks, Megan, and thanks, Samantha. So I'm actually the opposite of what Samantha actually pursued in terms of her career journey. So I started off doing a Bachelor of Science, General at WITS. And I was fortunate enough that my course, or my package rather, had different courses. So I had statistics, I had economics, I also had the social sciences type of like courses, so psychology, and so forth. So I had that combination. And it was while I was doing the BSc that I just, grew a love for the social sciences. So I left, I think I was in my second year or first year, I can't remember. And I left the BSc and enrolled into the social sciences and ended up with a degree in social sciences. I was also fortunate enough to also get work exposure. So after my degree, I enrolled for honors and masters in demography and population studies. Firstly, because I thought the course in itself gave me a good combination of both quantitative and qualitative skills. And that's what it did for me, right? There's a lot of quantitative analysis and quantitative research that is done in demography. But in addition to just providing numbers and statistics, we're also interested with explaining why. Why do we see an increase in HIV prevalence? What should we consider, etc. So I was quite fortunate to find a balance of both. So in a way, even though I was running away from the Bachelor of Science, I found it in demography. I was also fortunate to, like I mentioned, to go and work, right? So for me, I basically wanted to get an honors and a master's degree, and I was not sure what I wanted to specialize in, which is, I think, my biggest advice to anyone, and we'll get to that at a later stage, is public health is broad, and it's always good to find your niche area of focus and develop your skills in that area. So in my 2 years, and I worked while I was completing my master's, I think I worked for 2 years, and I worked for Genesis Analytics, where I'm currently at. And I got exposed to a wide range of health projects and programs in HIV, in chronic diseases, etc. And that's where I grew my love for chronic, prevention, which includes now HIV. And then while I was working, I decided I found my niche area of focus, and what I want to do is now specialize. So I left, and then it took 3 years actually, to pursue my PhD. So I just completed my PhD last year, November, December, and I'm back at Genesis as an associate. So yeah, that's basically my career trajectory.
Fantastic, and congratulations on your PhD.
Thank you.
Well done. Over to you, Shrikant. Thank you. You're on mute. I think it went back to mute, Shrikant. We can't hear you.
Double click.
There you go.
You can hear me now. Okay. Great. Sorry for the delay. I'm on provincial service, so the network can be slow. Thanks. So yeah, my background, I am a UCT alumni. So I studied MBCHB medicine at UCT. It's the new curriculum for the last for 15 or so years. And so it's problem-based learning. And I finished in 2010. And then the traditional route for a medical graduate is internship, which I did in Durban, a busy hospital there called Addington Hospital. And then I came back for community service. I did a year in medical psychiatry casualty work in Easter River. And then we bounced around a lot in our early years. So then I did a year as a medical officer, a junior doctor still, in Hillbrow, which is a very busy clinic in central Joburg and surrounding areas, Lanseria, some geriatric work in the area. The problem is, a lot of health sciences graduates will tell you the biggest frustrations with being a health sciences or healthcare practitioner is the systemic dysfunction in healthcare services. And so it often makes delivery of quality healthcare impossible. Even though you're trained to save lives, you simply can't because of the systems that work around you or fail to work. And it's very frustrating as a new graduate. Coupled with that is this sort of narrow focus of clinical medicine, which means we focus on diagnosing and treating individuals, often to the exclusion of things like public health, which can seem quite abstract to clinical professionals, and they then get left out of the bigger conversations. So I started in public health, also in the Masters in Public Health program. I started as a student who was paying to attend the MPH programs during my community service year. But after 2 years, I changed degrees to the Masters in Medicine track, and I became a registrar in public health medicine. So not many people are aware. A registrar contract is a 4-year contract that you enroll in to become a specialist in either pediatrics, surgery, obstetrics and gynecology, internal medicine. It's a 4-year paid program. And in that time, you become a Masters of Medicine in the field of your choice. As a registrar in public health medicine, then for the last 4 or 5 years before I graduated, I worked as an apprentice with public health medicine consultants in the Department of Health. And the rotations include things like data management, healthcare quality improvement, health strategy and policy development, and finally, district and facility business management. So you work in the Department of Health while you're studying, and then you specialize at the end of that time, which is where I am.
Thank you for that. And you've given us a taste of the different kind of specialisms that you could go into with regards to public health, like policy making, management, that kind of thing. So thank you for that, Shrikant. So to our second question, maybe let's stay with you, Shrikant, if that's okay. My next question is, tell us a little bit about your current organization, being GSH, and the role that you actually play there. And then we'll move on to Motlatso after that, and then Samantha, if that's okay.
So traditionally, when you work as a public health medicine registrar, you rotate in the government offices. So whereas doctors and other healthcare professionals work strictly in facilities, as a public health person, you will work in the back offices of the Department of Health. You know, all these things where people have various complaints about supply chain, finance, HR. And then as a registrar in my final year, you have the opportunity of working as an acting medical manager, or what used to be called superintendents of hospitals. So it's quite odd in that you're still a very junior doctor, you're a registrar, you're still a trainee. I was 30 years old when I started working back at Groote Schuur Hospital as a manager. And it was odd because I was busy. I was responsible for managing the clinicians who had taught me at medical school and the professors. So I was the one chairing the meetings, balancing the budgets, and running the operational services in main theatre and ICU. So currently I manage, so I'm in the theatre space. My office is in the main theatres. We look after about 25 operating rooms. We also look after 25 critical care beds, and we're expanding into the high care service. When I'm on call, like other doctors are on call, I act as the chief executive officer for the hospital, and that's about 2 to 3 times a month and some weekends. Currently, I manage a budget of about 600 million rands per year, and it includes all nurses, clinical technologists, allied health staff, medical staff, admin staff, and the medical staff from interns to registrars to consultants to heads of department. I have to manage in my area. As a manager, my core responsibilities, I see it as a T, the vertical line being management of the clinical silos, and those are anesthesia and critical care. And then it's my job to connect those silos to the transversal services in executive management. And that's human resources, finance, supply chain, information management, infrastructure, and engineering. So those are my core competencies. And together with those, I'm expected to run the divisions that I manage as businesses, and I'm also responsible for leading. Specifically under leadership, it's my responsibility to make sure healthcare teams are functional and are able to improve the quality of care they provide to patients. Thanks.
Wow, that sounds like a loadful. Thank you for eloquently explaining your responsibilities, Shrikant. Motlatso, over to you, please.
Sure, thanks, Megan. So I work for a consultancy firm. It's based in Johannesburg, but it operates in Africa, and we have offices in London and other places around the world. So basically, the consulting firm is mainly an economics-based consulting firm, but over the last five years, they established a consultancy practice that focuses specifically on health projects. And over the past 5 years, that's while in between my gaps of studying and working, I've been working in that practice. So basically, our work in general involves project implementation and management on behalf of clients. So, for example, one of our clients is the NICD. Many of you will be familiar with the NICD because they do the reporting on, for example, COVID statistics, etc. And they also do other, reporting on specific indicators that are of interest in the field of public health specifically. So stuff like COVID, HIV, etc. So currently my responsibilities include managing and coordinating some of their surveys, specifically the antenatal survey that is run every 2 years. So my responsibility is to make sure that, firstly, because it's nationwide, that there's enough field staff that go out to collect the data, that the data comes in and is analyzed and is fed back to the client for reporting purposes. But before that, I also want to mention that so my role is specifically to look at HIV-related projects because I specialized in HIV. So my PhD was on HIV chronic comorbidities. And essentially what I did is to find out or try to establish how long it takes HIV diagnosed persons to develop additional chronic conditions. So it's an area that I'm quite familiar with and I'm experienced in. So a lot of the projects that I take on are specifically in HIV. So that covers the first point. So it's a lot of project implementation on behalf of clients. We don't do, as a consultancy firm, any implementation ourselves because we are a consultancy firm, and a lot of coordination and management of those studies. We also do a lot of project evaluation. So, for example, one of the main projects I'm involved now is to evaluate the PrEP projects that were implemented in South Africa, as well as other Latin American countries like Mexico, Peru, and Brazil as well. So PrEP means pre-exposure to prophylaxis, and it is quite an effective way of preventing HIV. In South Africa, we have the oral PrEP approved. That is being rolled out to firstly sex workers, but now we're moving to rolling it out to adolescent girls and young women, etc. So those projects were funded by an organization called Unitate. So this happens a lot, especially when there's a new product in the field and that the government, for example, want to establish whether or not that product is effective. So these projects fund organizations in South Africa and different countries. And at the end of those grants, if you may, they call in a team of evaluators to come and understand, did the project meet its objectives? Did it stick to the timelines that it was intended to? What are the lessons learned from that project? Can it be scalable to other contexts, etc.? So my role then is to do those evaluations on behalf of client again. So this is a question I always get from people in terms of, so do you implement projects? And the biggest difference between normal health organizations and a consultancy firm is that we do not own any projects per se. So we are consultants and we are often called to input on existing projects or conduct evaluations, like I said, or coordinate, etc. So that's a bit of just in a nutshell what I do.
Yeah, it also sounds fantastic, and I love when we hear what Shrikant said and now what you said, Motlatso, how wide the breadth of public health actually is.
Absolutely.
So thank you for sharing that with us. Thank you. Over to you, Samantha.
Thank you, Megan. It's quite exciting actually thinking about how many, like the particular speakers that you had on the panel today, because we all seem to work in a complementary manner where Shrikant is working in the facility, doing the work, getting people help and support that they need. And Motlatso, you're working more at a little bit removed, getting the data and collating it. And then I work in philanthropy where we're funding the institutions that are getting the data together, and we're working alongside you, Motlatso and Shrikant, to make sure that we work towards ensuring that the next pandemic doesn't happen in the way that it's happened, for example, or having positive health outcomes for institutions or communities later in life by learning what's happened and noting down best practices for future. So just in a nutshell, just to let you all know what ALMA does, the ALMA Philanthropies provides philanthropic advisory services to the ALMA group of foundations. And we invest globally with an emphasis on improving the lives of children in Africa. And our kind of footprint for where we work is the African continent. And for the work that I do specifically, it's in sub-Saharan Africa. So my role as a program officer is, and my passion and what I've chosen to work on because of my academic background, but also just what draws me in, has been maternal and child health, sexual and reproductive health rights, improving the health system by working with digital health, but even beyond that, working with facilities and communities to get the best source of support for communities and working in collaboration with communities on the ground to figure out what needs to happen. And we do that not by going on the ground and at the coalface, but rather working with institutions that have for years worked with the communities that we want to serve and coming up with a grant that is not burdensome to the implementer, but also that is not, that doesn't drain the community that we're serving in terms of putting the burden of proof on them to say, we need this help. And, you know, it's more of what's the issue? Let's fund to make sure the issue is addressed and to minimize the strain on the people doing the implementation and the beneficiaries. And more recently, I'd say in the last year and a half, my focus has been on COVID-19 vaccines and immunizations and ensuring that the health systems that we have in place and the work that's been done is maintained. So maintaining essential health services, so giving out grants and working on grants that sustain and maintain the health system. So what happens on a day-to-day is I would source an organization that is working on the ground, helping a community. So if we work through, for example, a COVID-19 grant, it would be figuring out what community is, what organization we're currently working with that is working on HIV/AIDS and ensuring that there's a retention of clients to care or patients to care. How have they been impacted by COVID? And then ensuring that we are funding projects that make sure that we are able to find people who have been lost to care and bring them back into healthcare services, working to make sure that the project or the grant that we're giving isn't burdensome on the people in the clinics or in the hospitals by like asking them to do something that's outside of their role. Instead, we're trying to make sure that whatever we're funding is not burdensome to the people. And then, so that's grant creation. And then grant management is checking in with the implementer every couple of months to find out how it's going, what further support they need, the measures that we've asked them to attain, have they been reached? If they haven't, how can we get them to reach those measures? Yeah.
Thank you. So thank you for giving us that insight. And I just wanted to touch on the fact that you brought in your passion and your interest, and Motlatso, you did as well. That also has an impact on how you decided what to actually specialize in and what your role might be with that. So thank you for sharing. So over to my next question, which is about the skills that you utilize. You know, in your day-to-day job, what are those skills? What do they look like? Maybe not so much about the discipline-specific stuff, but other skills that you might have developed elsewhere that you bring into your role. So maybe Samantha, if we stay with you, and then Shrikant, and then last Motlatso, please.
For sure. I think one of the biggest things that I've learned and one of the biggest skills that you need is communication, being able to communicate with people from a grassroots level, so a community mobilizer on the ground, to someone who's in National Department of Health at a very high level, to your board members, to your colleagues. So being able to, in a sense, code switch, help translate, knowledge translation, help figure out what is needed, package it in a way that your audience understands, depending on who you're talking to, and ensuring that what needs to happen and what needs to be communicated is understood clearly. Another thing is monitoring and evaluation. I think those are very important skills in philanthropy, because you need to make sure that the investment that you're making is impactful, and that you're monitoring the way that the funds are being used, and that they're being used for what you said they were going to be used for. And then lastly, I think one other skill is understanding epidemiology. Again, as I said, I'm on the qualitative end, but there is a way to look at so I will look at the data that we see from NICD, for example, and different places where there's hotspots, and you see that there's obviously a spike, not at Christmas, but a few weeks, a few days after Christmas. And what I do as a qualitative public health specialist is to see, why did this happen? I mean, you can do the stats and everything, but we have to also then inform policy when you're thinking about it. Why did this happen? And the reason that it happened is obviously people are coming together in this community, and everyone knows what's supposed to happen, but there's cognitive dissonance. You want to see your family, you want to be part of your community, and you have to understand the context that you're working in. I think when you're doing a grant, for example, you're not going to start it, if it's in South Africa, you're not going to start it December 16, because nothing's going to be done between December 16 and January 15. You're either going to shift it and start in November, or you're going to start in January. Just understanding that kind of being able to read the room, read the community, and get a sense of what's going on, and then apply that practically in the work that you do. I think those are skills that are not learned in the classroom, but are learned on the job, and in doing internships, paid and unpaid, preferably paid, because it's tough. Yeah.
Yeah, so I'm glad that you've mentioned the different types of skills. And, you know, when we think about communication skills, I always think it's not just our verbal skills, which you've alluded to, but your writing skills as well. And so communication covers a whole range of that. So thank you for sharing that with us. Shrikant, over to you, please.
Great. Thanks. So core skills that I use in the job. Yeah, so I mean, in the last 2 years, you know, we've needed to overturn the service to run COVID. We've had to escalate ICU beds ×3 to absorb the number of people coming in. We've needed to stop theaters, run intubation teams, just respond to an overwhelming demand beyond what we normally see. In my current post as medical manager, as also as a public health specialist, the core skills, and I say this, you know, my undergraduate degree is in medicine, but our core skills are still medical diagnostics. We do need to, on an individual level, understand disease. We need to have an ability to diagnose and treat illness, and understand how that is done. It's a foundational requirement to manage medical services. And basically at our level, when a clinical person comes into public health, they always look at public health through that lens. And so what we do is we apply the clinical method of taking a history, examining, diagnosing, and following up. We take that from a patient basis to looking at entire systems. And so one of the fathers of pathology and public health said, politics is just medicine writ large. And so there should really be no difference between politics. Politics has a huge impact on health. And there should be no reason why healthcare workers don't get involved in that space. It's seen as very messy compared to the clinical method. So basically we ask ourselves, instead of just why is this patient sick, we ask ourselves, why is the prevalence of disease in this population so high? And how do we improve the healthcare response and the general health of a community? So on top of a healthcare undergraduate base, the core competencies and skills we draw on from being involved in the same public health spaces as others in the MPH program and in the Department of Health are definitely systems thinking. So all those things which we are taught to sort of ignore, teamwork, how to work with others, how to do a root cause analysis of a process problem in a hospital or a health system, referrals, issues. And there's no more complex system than a health system with various actors and processes. We need to know about healthcare quality. We need to know how to define what is a good quality process and outcome in healthcare, and how do we reach that with maximum utility with a set budget. We need to know techniques around quality control and quality improvement. There's all sorts of tools from lean to design thinking, root cause analysis I've mentioned already. So that's built into our syllabus as postgraduate students. And then lastly, team management and leadership. We need to know about finances, how to run budgets, how to do a cost utility analysis for a new service and scale it. And then otherwise, from other places where I've picked up some skills, as registrars, we have to do MPH courses. We also do diplomas in occupational health, in health economics, and the diploma in health management. And then it always helps to have some kind of grounding in economics as a basic sort of unit of just how services and goods change hands in an economy, because we're not taught that as healthcare workers.
Thank you so much, Shrikant. So definitely more emphasis on your technical skills and the skills that you were trained with. So thank you for that. And then over to you, Motlatso.
I seem to have frozen, but hopefully you can hear me.
Yes, we can.
Perfect. Okay, so I think, yeah, I'm just quite happy that even the skill sets that we are talking about are quite diverse, showing even the diverse nature of the field that we are, practicing in. For me, I think the core skills are firstly having analytical skills. And I speak to this because a lot of my work involves, receiving data, collating data, and asking the so what question, and being able to make programmatic recommendations out of that data, right? So I think technically from a degree perspective, I did a lot of stata work. And now, with, advances of technology, etc., we're now moving on to using things like R. So I'll say in my field, having that technical skill is quite important to use analytical softwares like Stata, like R, because we do a lot of work like that. And then the second important skill I would think is important is project management. So I had to even do a certificate in project management because I saw a need for it in my workspace. And this is twofold in the sense that as you grow within the field, you're expected to now go into, for example, things like capacity building. So you need to understand how to train, how to manage, how to even do things like costing for projects, etc. So you're training, other staff members or, other junior level staff members and capacitating them on different things and on for different project needs. But you're also called into at times to, cost a project and speak to how that project is going to be delivered long term, for example. It makes me think of a time, I think of recent, I was asked to be a principal investigator for a project that basically wanted to reduce smoking among people that are living with HIV, but also now brought in sort of like an economic concept. We call the economic concept cessation. Basically wanted to limit the number of people that are smoking, and we applied behavioral economics principles. So to do that, we include things like nudging, and these are new concepts. They were new concepts for me, right? And that's why, as the field also evolves, it's also not enough to say, okay, I've got these set of skills, but you also need to be able to be adaptable to growing yourself and growing, your skill set, right? So project management skills, something that I had to, gain on the job, and actually just thought I actually needed to go out and gain the fundamental principles of project management. But the behavioral economics concept also brought into the element of behavioral science, which is also an increasing or a growing area in public health. How do we influence or positively influence people to make, better or good health decisions, for example. And that's a concept of behavioral science, also speaking to the broadness of the field, right? And it's a skill set that, because it's growing, it's an asset in the field to bring on that or people that have that skill set. So, like I said, being analytical, project management skills. The last one that I had down, I spoke to, and it was being able to capacitate others. So to grow your career, there's always also a need to see, do you have the ability to deliver or to impart or share knowledge and grow other people as well. And that's how, even in the corporate field that I find myself in, even as part of my KPIs, it's something that they look at. Can you lead? Can you manage? Can you transfer knowledge to other people, etc. So it's something that's an asset, really, if you want to grow in the field.
Thank you, Motlatso, for that. And I think just another point is that it's kind of continuous lifelong learning. And I think for the health professionals that are in the audience, that's a very key component, but you can see that in other areas as well. The fact that you are ever kind of developing in different skills, and as whatever the need is in that space that you find yourself in. So I think that's a very good point. Thank you for that. So I'm looking at the time and I don't see any questions in the chat. So please, if you have any burning questions, please pop it in the chat so that we can address it towards the end. And so thinking back to when you were a student, what would you have liked to have known? So I think maybe Samantha, if you want to have a start, and then we'll go to Motlatso and then Shrikant, please. Any wise words that you wanted to hear?
One thing I wish I'd known was it's okay for you not to have any idea what you want to be when you grow up. I studied right the way across from, I started off in media studies, English literature, and anthropology. I jumped over to law because I thought that's what I was supposed to do. I swiftly jumped back out and went to gender studies and found a little thread along the way and identified that one thing I'm passionate about is sexual reproductive health rights. And I was like, okay, well, what can I do with this? Because, and when I was doing law, it was from a legal perspective, thinking how we can ensure that the Constitution is used correctly to protect people's rights. When I was doing gender studies, it was from a lived experience and intersectionality perspective. And when I was doing English lit, it was looking at it as motifs in the books that I was reading and the books that we're analyzing. And I thought, okay, enough of trying to have a career that people think is the right career, a profession, or something that is that you could tell your parents and your parents could tell their friends about. And I said, let me figure out a skill and a career and a path for myself that is going to make me happy and that I'm going to thrive in. And so when I stumbled on public health and how broad it was, and just how malleable it was, and how you could find your own niche within the broadness that is public health. You could do environmental health, health systems, health economics, general, which is literally as open as it's going to be, epidemiology, and then my one, which I'm very biased and say everyone should do it, which is social and behavioral sciences. I found my voice almost in terms of what I was going to do in future. And so I delved into it and I was like, okay, so do I focus just on sexual reproductive health rights? I decided to focus in on HIV/AIDS. And, it's not like I went straight into philanthropy. My career journey was a lot longer than that. It was interning at a law firm, interning at NGOs doing work. It was figuring out that, okay, let me be a consultant. I was a consultant for a year, and I worked with, working on the Commonwealth and UNAIDS at that broader global scale, and then honing in on working with community-based organizations, and then finding my happy medium, which was working as in a philanthropic organization, as private donor funding, and just seeing the beauty of flexible funding and how catalytic it can be, how quickly we could move, how we could fund things that other organizations might not necessarily be able to fund, or donor entities couldn't fund. And the exciting thing about philanthropy is the skills that you can literally bring any skill set and you can make it work. And because you're working on so many grants and managing so many different kind of grants, your passions, all of your passions, any pet project you had ever wanted to cover, you're covering it. Right now I'm working on the first 1,000 days of children. I'm working on digital health and moms in pregnancy. I'm working on, we're looking into sexual reproductive health rights, looking at the environment and how to fix people's lived experiences and access to food and adequate nutritional kind of food sources. It's so great. So I think what I would have wanted to know as a student is, yes, my trajectory in my studies was not linear, and that's okay. I think there's a space with this many people in the world and with this many organizations, you'll find a position that works for you with your skill set of either fully quantitative, fully qualitative, or a mixed method in between kind of a thing. So yeah, just keep your eyes open, network, talk to people. Don't be afraid to send someone an inbox on LinkedIn. And sometimes people respond, sometimes people don't, and see where it goes. And feel free when you go to panels like this, if you hear someone speak about something that piques your interest, to reach out, because if someone's on a panel, they most likely are willing to walk through this journey with you and give advice and talk you through their experiences, and they're very excited to share their journey with you beyond this 1 hour.
Oh, thank you so much, Samantha. Wise words. I can't remember who I said next. Was it you, Motlatso?
I think it's me. And Samantha said a mouthful, and I agree. I totally agree. So I won't spend much time speaking to this question, really. Similar to echoing what Samantha was saying, is that it's okay not to know in the beginning. So like reflecting back on what I was saying earlier when we started, is that I started off with a BSc General, and my major in my head was going to be statistics. And that's because, I also came from a background that told me that you need to study something with maths, because that's the only way you're going to get a job. That was just it, and I came into Wits, or went to university thinking I needed to do something, that involves statistics, right? But a good thing that I did also, when I was having mixed feelings and mixed thoughts about where I wanted to see myself, is that I did make use of the career services at Wits. So I went to sit and had a few sessions with a career counselor who took me through the process of trying to figure out what is it that I was good at and what is it that I was passionate about. So, and we drew it down to two things, which I also reflected on at the beginning, to say, okay, so she asked me, why do you have a mixture of maths and social science, courses? I was like, because I don't know, because I just like them all, and she said, it's okay. And as actually I studied further, I found a course and a degree and now a career that speaks to both of those interests. And it was okay, although it didn't seem quite, I guess, clear at the time, like, what am I doing, but in the end, it made sense. So I think my biggest message regarding this topic is to ask questions. Samantha spoke about reaching out and getting the guidance, like as you progress, to say, okay, I'm having mixed feelings about where I'm at, and getting input either from a career service. You're fortunate, like Megan actually organized this, either from a career service, like I'm saying, or even just reaching out to different people and network.
Oh, Motlatso is frozen there. But while she unfreezes, just to say that if you do feel a little bit uncertain and you really don't know which way to turn, then most certainly book a session at the careers service, so that we can have a one-on-one and kind of talk you through what those steps can be to kind of find your niche. So I think very good point from her. So I'm going to maybe move on in the interest of time again. Motlatso, I'm not sure if you can hear us, but I'm going to ask Shrikant to continue. Is there anything else that you'd like to add to what has already been said?
Sure, Megan, would you like me to just zoom through to the end of all my, yeah. So
Yes, please.
I think looking back on what I wish I had known as a student, I think as an undergraduate health sciences student who generally found public health to be this boring thing that we didn't know what to do with, I would sort of fight back, and having walked the walk, I find that public health is the most important, the most exciting, and actually the most practical career choice in which a health sciences student can make the largest impact on the most number of lives. And so I think we need to work outside of our silos. It's very frustrating to only do clinical work. I mean, a lot of people get satisfaction out of it, but you need to pair it into leading health systems. You shouldn't be content to just be a conveyor belt worker and just do as you're told, which is what we train people to do. And public health, people always ask me, what are you going to do if you study public health? Because as a clinician, you've got the set path where you're going to work and be recognized, and your parents will tell people this is what you've done, as Samantha said. But it's not necessary that you're going to be happy in that space. The levels of burnout in clinical workforces 30 to 60% in various places. And it's not just because of clinicians, it's that it's solely looking at the small problems and not being able to concentrate on the bigger things to also flex your creative muscle. And what I realized was in the public health space, doctors with MPHs, doctors specialized in public health, health sciences graduates with MPHs, they're not working in facilities. They're the people who are directors, chief directors, director generals in the Department of Health, working for the WHO, for UNICEF. And despite the space being very impressive, they generally attract non-egotistical people. It's a democratic culture. It's non-hierarchical once you're in public health. It's not like the clinical fields, which are very hierarchical. But it's a place where you can still achieve. And so I'd advise for students that are entering the public health field, we've touched on it, but don't be a sheep. Don't choose well laid out clinical careers that will make you miserable. And I know that some of you can see it coming already. So don't be afraid to choose the path less trodden. It's okay to know your vulnerabilities, and it's actually a strength in public health. The thing with public health is you have to be comfortable with making it up as you go along. You have to be a maverick. You have to fake it until you make it at a certain point, and you sort of really have to just explore what is your niche in public health, and it's very rewarding. Thanks.
Fantastic. Oh, thank you. Thank you so much for those words as well. So I'm so much aware of our time and all these questions that have kind of come through. And so you kind of lose your thread a little bit. And so Zainab, there's a question from her. How can I find an internship in medical laboratory? I think Shrikant could help me in this question. So I don't know if you have any answer to Zainab's question.
Yes, Megan. So it depends on if you're health sciences or non-health sciences. If it's someone who is doing an internship, you can do community service here at NHLS. It's always good to talk to the local laboratory. If you're at UCT, there's one at Kruitskaya. You can speak to the registrars about how to apply for those community service posts. If it's a non-health sciences graduate, well, I'm sure at least a sciences graduate, there's NHLS, there's PathCare, there's a lot of private labs. But I would still say that NHLS is a good go-to for any UCT student, and they can put you in contact with the right people.
Yeah. Thank you for that. And so I'm just going in the order of how I see the questions. There's another one for you. How long does it take to get a Master of Public Health after your MBCHB, and where can I get exposure to the field of public health whilst doing his MBCHB?
So there is a joint program in place. So some of the medical students are doing some public health courses. The MPH generally takes between 2 years and 3 years. So it does fit nicely if you really want to do it during your internship and community service, but it is difficult sometimes to do it that way. So that's at least 3 years. But if you're going to do the master's in medicine, then it's 4 years registrar time, which you're being paid to be a registrar. and you're studying to be a public health specialist. So 3 years for MPH at least, and 4 years at least for the Masters in Medicine. What we say from School of Public Health side is get yourself involved in research, get yourself involved in primary healthcare, district health services, speak to your medical manager. They'll be able to put you in touch with the public health practitioners in the local Department of Health.
Thank you for that. And so there's a question from Vanessa, and she says there's usually a lot of competition getting into the public health space. And it seems like having studied anything around public health is taken to be an essential criteria. But how can you still get your foot in the door and rise up based more on work experience? How do you even get work experience? So perhaps Samantha, because I remember you said you did an internship. Maybe you could take that question, please.
So instead of doing waitressing or tutoring, I made sure that in my week, like in my breaks between term time, I was fitting in a 1-month internship here, a 1-month internship there. I started off as an unpaid intern in research units at UCT because they're always looking for research assistants and that sort of thing. I started off unpaid, very swiftly went to paid, and then building up my CV so that I've got some relevant work experience on my CV from the actual institution. And then I started looking outwardly. And if you're looking at the NGO space, for example, I went onto NGO Pulse, NGO Recruit. That's also 2 spaces that I used to scour. The UCT Career Services website is also fantastic, a fantastic resource. And what I did is if there wasn't anything being advertised, I would approach the institution and say, or the NGO and say, I would like to do a 1-month internship, or I'd like to do a part-time internship during term time, offer 3 or 4 hours a day, because quite a lot of my courses would be in the afternoon or would be in the morning, or I'd set it up in that way so that I would have a set amount of time free for me to go do an internship. And if you have access to a car, then you can do an internship a little further away. But if not, there's actually a lot of NGOs that are in the Woodstock, Mowbray, Claremont area. So you can just hop on a taxi, which is what I did, or a bus, and walk there, intern, and then come back to work. And one thing I will say is, don't then fall into the rut of doing unpaid work for long periods. You also have to know your worth. There is one time that I did an unpaid internship. But it swiftly turned into a paid one. I started off literally putting stapling documents and putting them into a folder, but I knew that the work that they were doing was in line with what I wanted to do, and then I would volunteer and say, hey, I see that you guys are working on this one HIV focused thing. Can I write a paragraph towards this supplement that you're handing in, or can I draft the abstract to your presentation, and then you can look over it. So I was being mentored for basically no pay, but it was a sacrifice I was willing to take because, to be fair, I also had a scholarship. So don't do it and go hungry. Make sure that what you're doing is within your means, and show your worth. Get your foot in the door. Figure it out from there, and then prove yourself. Work hard, and prove yourself, and explain from day one. Your intention is not to come in and be an administrator. Your intention is to grow in the field, and this is where you want to go in 5 years' time, 10 years' time, or in 3 months' time, 5 months' time.
Yeah. Thank you for that. And sorry, my screen is being obscured by the other stuff that's coming through. So Ruth, your question I'm sure has been answered by Samantha as well. So thank you for that. Let me just skim through these questions to see. Sambesiswe is asking Dr. Shrikant, do you only get to take registrar route after being a community service and after then being an MO? And could you please mention again the different streams one could take as they become a specialist in public health? Want to take that one?
Yeah, you can only specialize in any field of medicine after community service, but you don't need to have done medical officer time after that. Straight after ComServe, you can specialize. Generally, to the different tracks in the MPH I mentioned social behavioral sciences, epidemiology and biostatistics, health systems. There's global surgery that's going to start soon. To do the medical specialty, you do need to do epi and biostats. Although I didn't really enjoy epidemiology, I really liked health systems. So, you know, it depends really. I prefer health systems, and that's where I work mostly. But if you really want to specialize in it, you do epi and biostats, and you grit your teeth and you get through odds ratios and stats.
Thank you. Sorry, I'm being distracted by all the questions. I'm skimming over some of them. There's a question from Mukundi. Does PEPFAR still run the fellowship program on monitoring and evaluation, and is it a good route to get into public health field? So I'm not sure who mentioned PEPFAR early on. Does anyone want to take that question? No takers?
So there's, just to let you know that you don't necessarily have to do it through PEPFAR. I just did an M&E course through UCT Get Smarter, and that was way cheaper than doing any other course externally. And if you're working on the continent in South Africa, that's a great one to get from a university institution that is recognized on the African continent. If you are looking to move beyond South Africa, Sub-Saharan Africa, it would make sense to do the PEPFAR one, but also just make sure it's in line with what you're hoping to work towards. And just because it's PEPFAR doesn't mean that it's you know, just a script. It won't change too much. But I know that there are always courses that are being updated, and PEPFAR gives it. And I think you have to check their website. I think that some of them are paid. Only do the PEPFAR one if your focus is very specific to a project, like maybe if you're working alongside MSF or something like that. But if you're thinking of more of a project management sort of a thing, very broad and NGO focus, then the UCT one makes sense. It's an 8-week course on Get Smarter.
Thank you. Thank you so much for that. So I'm watching the time and it's a minute to go. I thought we were going to have load shedding at 2, but I see it's not. We haven't gotten to some of these questions, but I think what I'll do is I'll collate them and see which of our speakers could answer them. So if that is okay, in the meeting chat, you'll still have access to, well, once we leave, you'll still have access. Only if your time allows, that will be great. But I would like to close our session by thanking everyone that's actually been with us in the room today. Thank you so much for taking, this hour of your time. And then, last but not least, I'd like to thank our 3 panelists. Sure, I really enjoyed engaging with you. Thank you for all the wise words. I'm sure that our students feel really inspired, empowered, and walk away with quite a bit of knowledge after this event. So thank you so much. And then I'd also like to thank our staff members that have actually made this happen, so they know who they are if they are on the call. So the last thing I'd like to ask our students is possibly to fill out our feedback form. And so I'll pop it in the chat. There's a link. It shouldn't take you long, and it is anonymous. And if you have, Nshlanshla, thank you so much. You've added it to the chat. I think that's about it. If you have any ideas about future career conversations in the Faculty of Health Science space, then we'd love to hear from you. We'd like to get some ideas. And thank you so much, everyone. It was lovely being here with you today. All the best.
Thanks, everyone. Have a good long weekend. Cheers, bye.
Yeah, have a good weekend and please be safe. Thank you. Thank you, Shrikant. Thank you, Motlatso. Thank you, Samantha.
Pleasure. Thank you for having me.